So let's talk about how to screen as well as treat your dental patients with sleep apnea. So the first step is to screen these patients for sleep apnea. So what you want to do is either use a form or you can just simply ask them. You can ask them if they feel worn down and tired during the day or they snore at night. And if they do meet those criteria, they may want to get tested for sleep apnea. Now, there are several ways patients can get tested for sleep apnea. They can either go to their physicians, but a lot of times patients won't follow up with that, or you can refer them to like an online website, for example, sleeptest.com. They do offer sleep testing solutions and they work with the physicians who orders the test. Or if you have a physician's order, you can also buy a machine that's FDA approved for testing for sleep apnea, and patients can rent that from you by a physician's order. Now, once the patient's been tested for sleep apnea, they may get diagnosed with either no sleep apnea or mild or moderate or severe sleep apnea. And the physicians who gets them diagnosed with sleep apnea is going to have an order on that form, which is going to say that patients, for example, in severe cases may have to wear a CPAP, or if they have mild or moderate sleep apnea or they cannot tolerate a CPAP, you can make them a sleep apnea appliance for them to wear at night. Once you have that report, basically, if the physician told you that you can make the patient this oral appliance for sleep apnea, then all you have to do is just select the appliance that you're going to use. You're going to bring the patient in. You want to make sure that they don't have gum disease, that they have all the requirements to wear a sleep apnea appliance. So, for example, you want to make sure that the cavities and crowns and things like that is taken care of, because these sleep apnea appliances a lot of times custom fit for their teeth. So if you do a crown after you make the appliance, it may not fit afterwards. So you want to make sure that all their teeth are in good shape and there's no gum disease, and make sure that they have enough teeth to support a sleep apnea appliance. After this, the only thing you have to do is just make the appliance. You have to select what kind of appliance you want to use. I really like Somnodent because it's a great company and they have good warranty on their appliances too, and they're very sturdy and they hold up really well. And the only thing you have to do is just bring the patient in and scan the arches and get a bite record. Sleep apnea appliances have what's called a construction bite, where you actually have to get a bite record where the patient's jaw is advanced. So you have to select that, how much advancement you want. And after that, you just see the appliance and then, make sure that it fits comfortably and the patients can wear it comfortably. And then you have a follow-up. But usually the physician wants to do a follow-up sleep test after the appliance been seated. And then you just have to maybe titrate it or check for the fit, and pretty much done after all these appointments. And you also have to figure out the billing, because it goes under medical insurance, or you may decide not to do billing and you just simply bill for the appliance. It's really up to you. If you need help with any of this, I'm Dr. Nagy. I teach how to do these procedures and these sleep apnea appliances for patients. We do have an online course that is 7 credit hours for doctors and dentists, how to treat these patients with sleep apnea appliances and how to get these patients tested, how to get them worked up, and how to fabricate the appliance from all the way from impressions or scan to appliance seats and follow-ups. If you have any questions, post it below this video and check out our course that we have online. It's completely 100% online. You can just take it. It's 7 CE credit hours. So you're going to get an ADS CERP credit for 7 CEs.